Hi everyone, and welcome to today's live video where we will be covering reflux. So thank you for everyone who tuned into our last 2 weeks live video. They were on anxiety, what anxiety is and how to manage anxiety. So today we're going to be talking about reflux. So we're going to talk about what kind of causes our reflux, the symptoms of reflux, how to manage reflux, and simple measures that you can do to help improve your symptoms. So first of all, let's start with what is reflux. So reflux is an acid reflux, is like a burning feeling that's in the chest, and it's caused by the stomach with acid traveling up, and sometimes it can even go up to your throat. This is also known as indigestion or heartburn. Throughout this video, feel free to actually ask us questions as we go along. We will endeavour to answer them. And even after the video is finished, you can still ask questions and we will do our best to reply to them within 24 hours. So we talked about a definition of reflux. So let's talk about the symptoms. So the main symptoms of acid reflux are heartburn. So heartburn is a burning sensation in the middle of your chest. Sometimes can be confused for heart-related pain because of how close it is to where the heart is. And one of the other main symptoms that people get is an unpleasant sour taste in your mouth. And this is caused by the stomach acid coming up, and it's not very pleasant at all. Along with this, what you can have due to reflux is coughs or even hiccups that keep coming back. You can even affect your voice. If the acid is kind of sloshing down your vocal cords, you can get a hoarse voice. It can lead to you getting bad breath if the acid's in your mouth, because the acid itself doesn't taste and smell very pleasant. You can feel bloated. You even feel sick because of the discomfort it's giving you. And often you can feel like the food is getting stuck in your throat because of the acid and how it makes your food, the food part of your esophagus quite inflamed and quite sore. And it can, as mentioned, give you pain in the tummy as well, because sometimes if reflux is left untreated, it can cause things like ulcers, which can get worse if it's not treated in good time. What you'll find with reflux is often your symptoms are worse after eating. The particular foods that we're going to cover shortly. It's worse when lying down and even when bending over. Often, I've had some patients inform us that even during exercise, they can get reflux, particularly when doing things like crunches or lifting heavy weights. Deadlifts, for instance, can bring on the reflux because there's a lot of pressure in your tummy, which pushes the acid up into your mouth. So let's talk about the causes of reflux. So lots of people get reflux from time to time, and that can be completely normal, especially when you have occasional symptoms. There can sometimes be no obvious reason why it happens, but if you constantly have symptoms, then the main cause is usually a weak anti-reflux barrier. And what we mean by that is you have your food pipe, your esophagus, which connects to your stomach. Now your stomach has the acid in there, and if the muscle at the bottom of your esophagus, your food pipe, is not as strong, what happens is the acid has kind of free reign sloshing up and coming up to your mouth. So let's talk about what makes reflux worse. So you'll find that some of this applies to yourself. So certain foods and drinks. So what kind of drinks can make it worse? So first of all, hot drinks can make it worse. It relaxes the muscle at the bottom of your food pipe, your sphincter. Particularly things like coffee, the caffeine content in there promotes that. Alcohol can cause bad reflux as well due to some of the chemical properties in there. Spicy food seems to be a very big trigger in terms of the food component. So anything that's got a lot of spice in, chili sauces, particular foods with a lot of spice, and that will bring on reflux. In terms of other foods, chocolates can bring on reflux, which I'm sure a lot of you will dread to hear. And even fatty foods, greasy foods, fried foods, they can bring on reflux as well. So food and drink, there's particular foods and drink that can bring it on. With some patients, they find a lot of food and drink brings it on, not just the one that we've mentioned. Being overweight puts a lot of pressure on your tummy, which then causes the acid to push up into your food pipe. Smoking can cause reflux. Women who are pregnant, I think you'll find a lot of women get reflux just in pregnancy alone, and that's just the nature of pregnancy, the hormonal changes, the extra pressure on the body. Stress and anxiety can bring on reflux as well. And the reason for that is because when you are stressed and you're anxious, it causes your body to release stress hormones, which then causes more acid to be produced. And then this has a knock-on effect causing the reflux symptoms. Some medications are quite suspect in bringing on reflux. A particular medication, a household medication that we use are things like anti-inflammatories, ibuprofen, or prescribed medication like naproxen. If you have like a backache or joint aches and you're taking ibuprofen regularly, don't be surprised if it brings on reflux. For those who are taking anti-inflammatories regularly, we actually advocate for another medication, something like omeprazole, to help protect the stomach, particularly if you're over 35 years old. Another thing that can cause reflux, whether you know you have this or not, is something called a hernia. Not a traditional type of hernia that comes out onto the skin that you can see visibly, but something called a hiatus hernia, which is where your stomach pushes up into where something called your diaphragm, which is underneath your lungs, a muscle. It kind of finds its way past that and comes up to where your lungs are, which means that the sphincter, the muscle around the stomach, which prevents the acid coming up, is lost its kind of tone in there. So a hernia can cause it as well. So let's talk about measures of how you can ease heartburn and acid reflux for yourself. These are simple lifestyle changes that you can do at home to stop or reduce reflux. So if you find that food, or in particular, or any types of food, bring on a reflux, so what you might find is a useful strategy is to eat smaller meals and therefore have more frequent meals rather than one big meal. The more you load your stomach, the more likely you are to have the reflux, just because the pressure on the stomach and the amount of acid needed to help digest the food amounts. Try and break your portion down into 3 small portions. So the one way you can do that is if you have a meal in front of you, break it down into 3 portions and eat it at different times. Another thing that really helps is trying to raise the head of your bed approximately by 10 to 20 centimeters. And the way you do that is by putting something under the legs of your bed at your head side, so that your head is higher than your stomach. And people find bricks to put down there, something stable, something that won't just rock and cause the bed to fall off. Now, some beds have wheels and it's not easy to do that, so you might find it easy to put something beside the wheels. And if you can't do that at all, then it's worthwhile trying to put something under your mattress near the bedside. It's not a good strategy to just increase the number of pillows, because by increasing just the number of pillows, it can increase the muscle tone in your stomach and make your acid reflux worse. It has to be the head of the bed particularly. And the aim here is trying to get your head and your kind of neck area and your chest above your level of your waist, so that the acid can't go back up to the stomach. If you're overweight, losing weight can have a profound effect. I appreciate this is easier said than done. There are services that we have within Tameside, namely Be Well Tameside, which help with things like exercise and diet, and even smoking cessation. So that's something that you can inquire about and get the details for. If you are interested, I can put the details below after the video as well in this video, so you can contact them without having to contact us. Another way, if you find anxiety and stress brings on your reflux, and trying to find ways of relaxing. We talked about some of these methods in our last video, and I think if you try and adapt these methods, it'll help with your stress and anxiety, and therefore help with your acid reflux too. As well as things that you can do to help stop acid reflux, the things that you shouldn't do that can make your reflux a lot worse. So there's do's and don'ts. So we've done the do's. The don'ts are things like not smoking and often at all, or reducing the amount of smoking you do. Be Well Tameside can help with that. Don't drink too much alcohol. If you are going to drink alcohol, have smaller quantities. Do not wear clothes that are tight around your waist. The tighter the clothes, the more likely you are to have the reflux symptoms, particularly things like belts or tight-fitting clothing. Another big don't is not to eat within 3 or 4 hours before going to bed. It takes a while for food to leave your stomach and the acid afterwards that's produced there. So if you were to eat and go to bed, there'll be a lot of acid in your stomach, and therefore you'll get reflux when you lie down, when your food pipe is the same level as your stomach as you're lying down. So that's another thing. Another thing that you could do is keep a food diary. So if you're not sure what's causing your acid reflux, it's not the traditional things like spicy foods or hot drinks. If you keep a food diary and then mark down the times you have reflux, what you might start finding is a pattern. Certain foods might crop up that kind of trigger your reflux. And what you'll find that different people have different triggers to their reflux. So that's a very useful strategy. And then what you can try and do is to prove that theory is to eliminate some of those foods from your diet, and then often you'll find that your reflux improves. So there are the do's and the don'ts. Now, treatment for reflux. So before seeing your GP to help with reflux, there's some things that you actually can get over the counter from a chemist without a prescription that can help in the short term. These are things like Rene or Gaviscon, and Gaviscon comes in a couple of different flavors. What these particular medications do is they provide a protective barrier over what's already in your stomach, and it can last up to 4 hours. So it'd be best to take them soon after eating food, and particularly before bed. That coating will help prevent some of the irritation in your stomach and your food pipe gets if the acid is sloshing about. And is after eating and at bedtime is when your reflux are the worst. So that's why the strategy is to use it after eating at night time. If you have been taking Gaviscon and Renes regularly and you've tried the above measures and you're still having trouble with reflux, that would be an ideal time to get in touch with your GP. There's a lot we can do to help manage this. We would take a history, see what kind of triggers you have, see if there's any other kind of potential symptoms, such as symptoms of a hiatus hernia, like I mentioned earlier. So for patients at the Brooke Surgery, you just need to go on our website, click the green button and put a request through, and we'll endeavour to get back to you the same day. For patients that are not members of the Brooke Surgery, we are welcoming new patients here. So if you do want to join us, you can go on our website and click the patient sign up, and we try to get you registered within 24 hours of a working day. And patients out of areas are welcome. I hope you find this video useful. Go through the video, look at the do's and don'ts, try them. If you're still struggling, get back in touch with us, and we'll be happy to help you. So thanks for tuning in, and I hope it's been useful. If it has, please like and share with your friends, and see you next time.